Hello, everyone, and welcome to Transparency, Accountability, and Communications, the Key to Stakeholder Trust. I am Morgan Martinez, and I'm the Director of Communications at Interaction. Today, we'll be talking about the cross-section between communications and monitoring and evaluations and learning, which we also call either MEL or M&E, and how NGOs communicate outcomes and outputs to ensure transparency and accountability. Now, as I just said that out loud, I realize that's a lot of jargon and NGO jargon, but here's the thing. Monitoring and evaluation data is often just not sexy enough, and therefore it goes straight to donors in either quarterly reports or final reports. And then that's kind of the last time it's used. Meanwhile, communications professionals like myself are always looking for new data and success stories, but at times that data is not really put at our fingertips, and we're always looking for something new to promote. When those two things don't come together, and we don't talk about M&E and comms the same way and where they meet, we lose an amazing opportunity to gain local partners' trust and how we can be very transparent and held accountable through with our stakeholders. So to discuss this more, I have three great panelists. First, Dylan Diggs. Dylan is a monitoring and evaluation specialist at State Department's Democracy, Human Rights, and Labor, the DRL Bureau. He has over 10 years experience in M&E and specializes in the Middle East and North Africa. Grace Dungu is the Media and Communications Manager for Mercy Corps in Africa and is responsible for providing strategic comm support in about 17 country offices across the continent. Charlene Reynolds is Director of Strategic Partnerships and Communications at Chipago. Charlene has a prolific background in communications and overseen the promotion and dissemination of successes and learnings in more than 40 countries. So, these are our esteemed panelists. I'm excited to get this conversation. Dylan, I am going to start with you because really this whole conversation really wraps around M&E, right? It's the glue that's holding this all together. The purpose of monitoring and evaluations, as you know, Dylan, I don't need to tell you this, is to apply the knowledge gained from evidence and analysis to improve outcomes and ensure accountability for the resources used to achieve them. But what we're looking at today is how NGOs can use M&E data or MEL data to be transparent with local partners and how it can hold NGOs more accountable to their stakeholders. As an M&E expert, how can NGOs better use M&E and that is collected in the field to gain trust with beneficiaries?
It's an interesting question because there's a few concepts to unpack there, but one of the biggest elements is use. I think in the industry there was an evolution from pure accountability focused M&E towards more learning, that we use data to help learn and evolve both as an organization and as a community. And so as a part of that, you need to create feedback loops essentially that, yes, collect data, but also aren't purely extractive from the communities in which we're operating in. And so what you want is that data to come back and be heard in those communities. And so, there are some methods that are decreasingly innovative, right? As time passes, they're not as much innovative, but I think they're important principles. I'm a big advocate for collaborative and participatory and consultative processes, and depending on your relationship with beneficiaries, you might use different methods, but at least adopting a principle that it can't come from the INGO down to the beneficiaries. What we really need is a conversation from beneficiaries up. And then hopefully there's more of a conversation about what do these outcomes mean? What is the most realistic result and what is the most relevant result related to these communities? What does change look like and what is important regarding change? And I think using methods like most significant change, outcome harvesting, other participatory methods like photo voice. There's some methods that can use video for people to tell their stories. There's a bunch of metrics. There's qualitative and quantitative data, but at the end of the day, it's all storytelling. It's different ways to tell folks a story, and we need to make sure that those stories are shared. And that's the point. And that sharing that story, analyzing it together, working with it together, that is really kind of what we need to move towards as a community, as a democracy, human rights, and governance community, or whatever letters you want to add to it.
Grace, thank you so much, Dylan. Grace, going into storytelling, because I know Mercy Corps is doing some amazing work in Zimbabwe around COVID-19. Can you highlight the program, the successes, and your use of storytelling in those successes? Because I know that's been really important to you as well.
Yeah, so I'm going to talk about what we're doing in Zimbabwe, which is super interesting. And it's a program that I'm really, really passionate about because, as Dale and Ed already alluded, it works with the community. And that's what we need to do to be able to create the trust and also to inspire and aspire the community that we work with. So I'm just going to talk briefly about the campaign that we did. And this was specifically to respond to COVID. Because when COVID hit, when COVID pandemic hit Africa, we needed to think of new and different ways of working. But at the same time, we were facing rampant misinformation. And there was little trust in organization, institutions, and public as well. So we really had to think of how do we get to ensure that we are still committing to the people. And one of the biggest issues that we wanted to address was really fighting stigma. COVID had a lot of stigmatization associated to it, and people who had recovered, people who had COVID, were seen as people who are not supposed to be part of the community. But at the same time, we still needed to ensure that people continue to observe the protocols. As you know, I mean, in this region, people had to compete with different other things. You had COVID, but at the same time, you're thinking, I need to get money to feed my family. So there were so many other competing or so many other layers that were actually making people think that either I observe the regulations or I starve or my family starves. So it's a really difficult situation and a really difficult to navigate. But so we came up with this campaign, which was a purely communication campaign to address these two issues. And because of the societal and regulatory the regulations that had been put in place to mitigate or to reduce the spread, we really, honestly, what we did is we heavily invested in the social capital that we had built before COVID. That was our biggest weapon, because as Daylan alluded to, we can't build relationships during a crisis. We have to invest in building relationship before the crisis. And these are relationships at personal level, at organization level. And so these relationships are really the ones that helped us to go to the communities and be able to speak to them and for communities to listen to us. And remember that we are working against such huge barriers like misinformation that were that were being spread through WhatsApp. As you know, WhatsApp is one of the biggest medium of communication in Africa. In fact, it's probably, for many of them, it's the only interaction with the internet. And anything that is received within that medium is believed to be true. So we called on the relationships that we had built, and that include the media, because we worked heavily with the media, included the communities that we worked with, and especially the local communities, to be able to go through this campaign. And what we did, we took a lot of tools that we worked with, and one of the most powerful tool that we used was social listening. We went through the communities to listen. What are people hearing? What do people know? What are the rumors that are going around? And we did a lot of social listening that really enabled us to go back and say, okay, this is what is happening. Are the micro narratives that are happening, along as people in the village gather around to have some coffee around the village fire, what is the conversation that was going on? And so these conversations and these micro narratives really helped us to come and create some of the programs in order to be able to run this campaign. And to give an example, which was a very, very clear example, is that because we're implementing the project with a lot of partners, we installed taps, which are just standard taps in communities, because we needed people to wash their hands as one of the preventative measures to COVID. And because of having really good relationship with the partners, and having this micro narrative as a powerful tool, the partners came back to us and told us, those taps that you have installed are not going to work because communities prefer tippy taps. Tippy taps, for those who do not know, are foot pedal operated, and they are very simple and safe way to wash your hands, especially in regions where you don't have running water. The people that we're trying to reach don't have running water all the time. So they came back and they were very sincere and told us those taps are not going to work. And so we had to move back and actually give people what we want. But what really helped us is because of these connections that we had, the social capital that we had built. And this social capital had helped us, increase, because we had already had the trust, but just increase that kind of trust, that kind of responsive and trustworthy on the kind of work that we were doing. And just to mention that this is a campaign that was extensively successful, covered by a lot of local media in Zimbabwe, through radio, through social media. We used platforms like WhatsApp and Facebook that is very popular in the region. And also we had, international media like the Associated Press, highlight on the project. And for us, when we look back and measure the success, it is honestly because of the social capital that we had invested in across the spectrum.
That's amazing. And it tees up, Charlene, this kind of, trust that you built. I know that was huge for USAID's Maternal and Child Survival Program, which you helped implement and do the communications around. Could you tell us a little bit about that program? And I know that one of the centerpieces of that was that you ensured what you learned during that program and passed it on to different countries. And so they used the data and the information to actually build out their plans. And so I'm hoping you could touch on that as well, because I think it's really important to hear about that.
Yeah, no, absolutely. And I definitely echo a lot of the points that both Dylan and Grace have made. As USAID's flagship program in maternal, newborn, and child health, MCSP had the opportunity to reach women and their families throughout Asia and Africa, as well as select countries in Latin America and the Caribbean at both the facility and community levels. Beyond simply delivering a message, we were able to provide theory-based, research-driven communication strategies to address individual change and change within the broader environment, taking into account environmental, structural, and sort of cultural barriers. So our efforts really sort of addressed the provider behavior and improved quality of the client health provider interactions and strengthening the linkages between the community and the health facilities. So one approach that we used was the community action group cycle, which applies group-based dialogue and learning approaches and engagement of community champions. When I visited Malawi under MCSP's predecessor project of USAID, MCHIP, I was able to see the work of the community action groups. They were true leaders in their community. They took pride in the health and well-being of their community. They showed me a problem tree that they had drawn that identified all of the barriers of care that women were experiencing in their community, and especially with being able to access a health facility. And then once there, what were some of the barriers to them receiving high quality care or even wanting to return to the health facility because of perceived lack of quality care or mistreatment, etc. So I was able to sort of talk with some of these community action group leaders who were mentors and true leaders in their community co-chaired by the village elders who were right there sort of championing all of these efforts. And once they sort of identified what were some of these challenges and barriers, they were able to come up with some innovative and creative ideas to address them as a community. So from being able to pool funds for bicycles and motorbikes to having the community health workers interact directly at the health facility level and having sort of citizen-led hearings and group meetings. It really was an opportunity to see how they were taking the community at the community level, how they were taking some of their data and making sure that they were really being advocates for change within their community and at the health facility level. So it was a really neat experience and one that is is seen throughout countries, I'm sure Zimbabwe as well. In Tanzania, MCSP had conducted a study that looked at birth spacing and optimal nutritional behaviors. So the study had tested the use of innovative communication approaches for influencing nutrition and family planning perceptions and practices among women, their family members, village leaders, and health providers. And it's funny, Grace, that you should mention the recent campaign for WASH in Zimbabwe, because one of my favorite advocacy days is October 15th, Global Hand Washing Day, which is also a great day to capture a lot of wonderful photos and communications assets for promotional activities and success stories, etc. But this, Advocacy Day obviously focuses on the increasing the awareness and understanding about the importance of hand washing with soap, especially relevant today and in these current times. And so just really trying to focus on ways to prevent diseases and save lives. So from country and context specific awareness campaigns, we saw hand washing stations for children to be able to wash their hands, the distribution of soaps, the discussion over access to water, to clean water and what that meant for various communities. And truly being a day for almost a cause of celebration and educating the community about the importance of WASH and what that means for infection prevention efforts. In Rwanda, I was personally moved by the story of one woman in particular. Her name is Claudine. She had delivered her second child who had passed away, and due to complications from the surgery, she had developed fistula post her delivery. So she had been suffering with the loss of a child and now has a medical complication that is very stigmatizing and very isolating for many women in communities around the world. So MCSP had been working with community health workers and the government of Rwanda to have screenings where women could come who had also been experiencing fistula and be sort of determined if they were good candidates for a simple surgery that could help repair that fistula. And so Claudine was able to receive that surgery. And one of my proudest moments was being able to see her stand up in front of a crowd of over 1,000 people in Rwanda telling her story and encouraging all women who were experiencing these health issues to come forward and not to be afraid and to be advocates for their change. So for me, any sort of efforts at the community level or any social behavior change communication efforts are really, really crucial to implementing our work. And some of my most memorable activities are because of the community health champions and leaders I have been able to meet along the way.
That is great. And one of the things that I think we keep coming back to is, and Dylan said it in the beginning, and we're really talking about it, is ensuring that the information comes from the people we are serving and is moved up. And I think that one of the things that we don't necessarily talk about as well is the fact that when we talk about accountability, we think about being accountable to our donors, right? We think about being accountable to the United States government, if they're funding it, USAID, the State Department. We think about being accountable to, if it's American donors, it could also go down, even thinking down to the taxpayer. But But what we always kind of miss about it and how we use data is how we are accountable to the people we are serving. And so, Dylan, I kind of wanted to talk about that with you because I know that you have had a lot of on the ground experience. And you've traveled throughout the Middle East as well to really work with the people that you're serving to ensure that their stories are heard and that they're brought back up and communicated, and that the people implementing are held accountable as well. So I was hoping you could talk about that a little bit.
No, absolutely, because I think one of the in the world of grant management and dealing with proposals and stuff like that, sometimes I think some of those mechanisms can make folks lose sight of the goal. And the goal ultimately is to help these communities and help change happen and to provide a voice to folks, to provide help folks enjoy their rights or bring health services to folks and stuff like that. And so ultimately, one of the things that I wanted to say was that, there's two things very important for any evaluator that's doing this work. One is to know your methods, know them extremely well, know the toolkit with which you can play, whether they be what's typically considered as rigorous, which is the quantitative RCT kind of stuff, but also the participatory methods, the collaborative methods, those, because knowing both of them and making sure that you are well versed in that will allow you to be flexible. And that's the second point, is that we evaluators, especially in my world, which has been DRG, but I think also in health and education, all these different fields, need to be like Bruce Lee used to say, be like water, right? We need to flow with the dynamics in the community. We need to flow with how people talk. Data that's communicated needs to be communicated in a way that that is in concert with how people talk, how people think, how people feel. Because look, I love surveys and I love the 5-point scale. I actually don't. I hate those, but that's not how people think usually. They think more conversationally. They think more, not always linearly. And being able to capture that you're going to miss a lot if you don't. And so, for example, I alluded to it earlier, but we have a program in East Africa where this one grantee we have is using this video making that we teach students to take videos of community change in their communities, and they tell their story, they share their story around with other members in the town, and they get feedback from what that change looked like. And then you're able to analyze kind of how that change is evolving and how it's interpreted by the community. And again, and one of the reasons why that's so important is because you think differently than their forefathers, right? And so being able to find ways that speak to how they want to communicate their story is so important. And so that's the only way that we're ever going to be accountable to folks, is if we listen, as was said earlier. So
I also think, Dylan, and so as communicators, it's funny because for me, whenever I learned about M&E, it was about outputs and outcomes and data driven. And one of the things I have learned throughout my time as a communicator is that people connect with people, right? They don't connect with numbers necessarily unless it's wrapped in a story. And the way our brains work as humans is actually to tell stories in order to remember and to think. And I think that's one of the things where we do lose with comms and M&E, is that we are wanting to tell a story. It's just we're getting there a different way sometimes. And it's hard because if we don't work together as a group, then like I said in the beginning, the people that are missing out are the people that we're supposed to be helping the most. And storytelling, Grace, I want to go back to you a little bit about the storytelling, because I know that you have been pushing out stories about COVID survivors and making sure that people understand that this is not something to be outcast about. Could you talk a little bit more about how you got that data and how you gained the trust of the people to be able to go and talk about their survival of COVID?
Yeah, that's very interesting. And just to to add to what we were talking about, marrying data and storytelling, it's very important because data needs stories, and we as storytellers need the data. But sometimes we don't find that meeting point, and we find ourselves working in different ways. And for me, what I have found when we are doing any kind of stories, whether it's during COVID or before COVID, and this will be even after COVID, is that if you can connect, if we continue connecting, telling through storytelling, and connect with that data and provide context to that data, and vice versa for the data people, we can have really, really powerful stories that the community can link with, because this is about them. As Daylan said, the information is actually coming from them. And then now to go to your question, as I said from the beginning, what we did, of course, travel in terms of getting to the communities was really hard. So the tools, we used different kind of tools, but we also used the community members who are our partners within the locations where we were implementing the project. And so these are the people who were able to identify the COVID survivors who were, who had the courage to come and talk. But they created this confidence to come and talk, because it's not a simple thing. I don't want to be the one coming out and talking that I have recovered from COVID, knowing very well that there will be stigma associated to me being a COVID having recovered from COVID. So what we did is really capitalize on the people that we were working with, to give us, as Daylan said, to give us the conversation. What is it that they were hearing? What is happening? What conversation is happening amongst the communities? What are people talking about COVID? What are their concerns? Because we really have to think about their concerns, because I mentioned earlier that, we were looking at layers and layers of things, and sometimes you find that COVID is on the lower layer. You're thinking, well, there's COVID. I need to get out and look for something to eat, because I depend on daily wage that I get to be able to feed my family. So what we did is, of course, we used the previous data from other programs that we had worked on to understand, the community, the household, number of people in the household, and things like that to map out. But what really helped us is working together with the communities, working together with our local partners to be able to listen. And the key thing here was, let's pause and listen before we decide what we do next. And this was the thing that really helped us move to the next step, because then we were able to respond to to the specific ways that people wanted the response. And we saw people warming up to wearing masks, and we saw people warming up to, keeping social distancing in situations which are really, really difficult to keep social distancing. But because the message was what people really wanted to hear, the message was delivered in mediums that people had access to, that was, that people welcomed them and trusted that, this is actually something that really concerns me, and not the person who is coming to tell me. Because that when you lose that connection, especially in a crisis where there's mistrust, where people are not even believing, first of all, that there's COVID, it's very difficult. If you lose that connection between people, then you won't even go anywhere. But if you make that connection by listening to them, understanding what it is that they want, and be able to shape your response according to the information that you have received, then you will make it easier. And I think this goes beyond us as implementers, even as we move beyond COVID, because what is happening right now is that we are seeing secondary impacts of economic fallout of COVID. We have traders who are wondering, is the market going to recover? Am I going to be able to get back and feed my family the way I used to be? We have, for example, gig workers, across Africa, across the globe, and we have these young, innovative people who are wondering, how do I get back to what gives me, income. And just to give an example away from Zimbabwe, not so much digressing, but I think it's important to mention is that we have done a lot of work on gig work, in Africa, and particularly in Kenya, where in 2018 we did a study, and we found that across Kenya, the gig economy, online and offline, accounts for 83.6% of the working population. So we're talking about 14.9 million workers, young people. And so come COVID, everything is disrupted. These people do not have any safety nets to cushion them against the crisis. And so I think the biggest question that we have to ask ourselves as implementers, as donors, is how do we use this data that we already have to be able to design, to be able to design programs that will cushion these young people in the future. And also, I think there's a point that we mentioned, which was very important, that bringing the people behind the data by telling their stories is also very, very important. And it's also a very key aspect of building trust. And it's something that we have seen with our gig economy work, because we went back and, told the stories with photos, with videos, telling their stories, their personal stories on the struggles that they're having to overcome during this period. So I think it's very important that, to think about the people behind the data and be able to bring them as part of our storytelling, and that will influence us on how we tell the story. And that's how we will able to marry our data and our storytelling expertise, so that we have effective communication and effective impacts on what we want to achieve.
I think that's a great point. And one of the things, Charlene, I would love to know what your thoughts on this, because you are a storyteller, right? You're a comms person, so how have you worked in making sure that data is integrated into your storytelling and ensuring that it gets out to your target audience, which is also people in the country you're serving?
Yeah, I had always considered myself a comms professional first and a storyteller. But I realized once I moved over to the development space that monitoring and evaluation and learning were crucial to being able to be an effective communicator. So I sort of became, an M&E advocate, right alongside being a communications advocate, because I feel so strongly in the use of data. Because at the end of the day, what we're trying to achieve in either storytelling or in more robust data collection sets or being able to use data for decision making and accountability is to save lives, right? To prevent the needless deaths of women and children in the health. This is my particular issue area right now. And so you're not able to do that if you're not really looking at what data is being collected. Is it the right data? Is it being used in that moment for real-time decision making? Does it allow program managers and leaders to have information to be able to manage effectively health programs, to be able to have real-time learning, to shift where appropriate, and to really have that accountability mechanism in place? So in order for political leaders or other government officials or program managers, et cetera, to be able to do their job that will ultimately benefit the citizens of their countries, they need to have the right data at the right time, and they need to be able to use it in real time. And so I'm a big proponent in strong data collection, making sure that we're collecting the right indicators, that we're really measuring these and really being able to make progress towards some of the lags and successes that we've had. I think if we're going to really achieve the SDG era targets, we have a lot of work to do. I think that COVID has greatly affected a lot of the progress that has been made in some of the countries that we were hopeful about. I think that we've seen progress stall, and we've seen a lot of actual backsliding. So I think now more than ever, we really need to equip ourselves with the data so that we can work alongside others in, mothers and children and families and community leaders, what have you, to say this, this is what we need to do in order to get where we need to be. Mm-hmm. And so everybody's sort of data is everybody's business. And I feel that that's going to be really key to just reaching targets, exceeding targets, and being able to tell stories that ultimately affect the lives of beneficiaries. So I sort of got to a point with storytelling where you would, there were nice stories about, let's say, Claudine and what she was able to do, but then how many fistulas were we able to prevent? How many surgeries were we able to conduct that repaired fistula? How many women even were there, like Claudine, out there suffering in the community? So without that data, we're never really going to be able to solve the problems. And those are the problems, those are the stories we're trying to tell. So speaking of Rwanda, when I had visited a health facility, I'd taken a group of journalists out there to try to raise awareness. And this health facility had on every single door just the weekly data just hung up on the door as charts. And so it became such a culture within that health facility that everyone knew the data. They knew who was coming in, they knew what happened. They saw when they were making progress, they were comparing it to last month, to the week, a year before. It just became such a part of their culture and sort of their working ethos. And a lot of, the community health workers, they would go back to their communities because they're trying to refer patients to the health facility. So everyone from the health facility down to the community level was just so excited about the data and being able to make improvements. And they were like, we're doing it. We're getting better. We're not just, providing more access to care. We're providing high quality care. And so that became very empowering for them to be able to use data to make change within their community. And so I think that, I'm just a big M&E supporter. And I think that, storytelling can take you so far, but you need to be able to have the data for long lasting change. And then obviously for a lot of the work that MCSP had done and other projects I've been on, it's been more about those data collection systems and the, routine health information management and what have you, and indicators. But obviously for US Congress or US government officials, they're not necessarily interested, sorry, Dylan, in hearing all of the nitty gritty about that, but they want to hear, what are those big numbers? They want that data rolled up at a higher level, and they want to see the return on investment. They want to see the general impact of their funds. They want to see when countries or other donors have mobilized their own funding, how we've been able to leverage funding with other partners. So those are some of the data that they're looking for that is very different than perhaps what our counterparts at the country level in which we work might be looking for.
Dylan, you smiled when Charlene said data is everyone's business. I'm sure that's like really exciting for you, because I'm not sure how many times you hear that from comms, but it is everyone's business. And that's what part of this discussion is. And Dylan, could you maybe tell us a bit, some of the, like you said, there is new innovative tools people are using for monitoring, evaluations, and learnings, video, so forth. What else are you seeing? What should NGOs know about that maybe is a kind of like the secret sauce,
Yeah, I mean, there's no secret sauce. It's just, it's mostly, it's mostly holding to specific principles. I mean, I'm a big supporter of both big data and small data. And the truth is that big data is largely just small data in aggregate in a lot of ways. And so making sure that you're, all the stuff that we were talking about, building that trust and finding different ways to build that trust. I was talking about like having more approaches that listen to the ways that people talk. So ethnography, most significant change. Those storytelling methods allow you, and they give you the tools to more accurately capture what the change means when you start aggregating all that data and make it into statistics, right? And so then you can better identify, okay, this is where we might need to address this approach differently because these data are telling us something else. And so the main thing is listen, adapt, and stick to the tools that you have, and make sure that they are following specific principles of, building trust, consent, acknowledging kind of the time and place of things, but also that they link to a broader story and finding that contribution. I think that's the most important thing.
So we are going to be wrapping up soon. And so I wanted to go around and just make sure any final thoughts about this. I know that this has been a dense subject. Comms can be light sometimes, but really we all know that we get deep into the weeds as well. M&E is not usually light at all. It's it's lots of jargon. And so, yeah, last comments. Grace, I can go to you first. What would you like NGOs to know about telling people's story using data and ensuring transparency and accountability?
Yeah, thanks so much. I think, everything that we have covered in terms of, I think the key thing is that we have to listen. And to be able, even when you are capturing the data, when you are telling the story. And the other thing is that a community-centered approach is definitely the key to helping us build trust and to inspire confidence in the work that we are doing on the ground and to enhance long-term stability. Because without this centered approach within the communities, no matter what kind of data we have, no matter what kind of beautiful stories that we tell, communities are not going to trust us because we are collecting information for ourselves. But by centering on them, being able to amplify their voices, making sure that the face of the INGOs or NGOs is the face of the local people, their voices, their issues are being addressed. I think that is the only way that we are going to make it through, during this time when we're fighting a pandemic and even after fighting the pandemic, because the most important thing and the message to our communities, when we are providing or communicating on the data and also passing the data so that we can design programs that will advance their economic and social issues, such as health, as everybody mentioned, education, environment, is that we'll always be here. The communities we serve is to show them that we're not going anywhere. They are the people that we serve. They are our customers. They are the ones that, have brought us there. And so we will continue giving them confidence that we will continue supporting them in need to provide the life-saving aid that is needed, to provide the capacity that is needed so that they can also grow, is the most important thing. And I think that is one of the things that will be able to create that transparency and trust and change perceptions, by creating that trustworthiness, which is very vital in our work as the NGOs.
Charlene, last words?
Yeah, no, I completely agree, Grace. And I think that what's most important is that we work alongside communities and that they are forefront in our mind, that we're working in partnership with national governments, with health experts, with local communities, that we're really thinking about the human face behind the number, the data. And I think that that the trust is critical to success. And I think that if communities feel as though implementing partners, whether they're local NGOs or international NGOs or donors, what have you, are really there with their best interests in mind, and that they are really trying to ultimately improve their health and well-being, and they feel like they're true partners, I think that together we can really continue to make progress.
Just kind of reiterate what everybody said, build trust by listening, and then connect those to the broader change that you're trying to talk about, and then cycle that back. Make sure the data is not extractive, that we can always kind of learn from each other. I think those are important things.
And those are the perfect last words. I want to thank you all for joining me today, and I am just so excited about this conversation. Thank you again for everything. Dylan, Charlene, Grace, you guys are amazing. Thanks so much.
Thank you. Bye-bye.
Thank you.
Thank you.